everybody a few minutes just to kind of gather and get seated before we start. Welcome to our next breakout session entitled Testing, Treatment, and Compassionate Care for FeLV Positive Cats in 2025. We have with us today Monica Terrence, Chief Innovation Officer of Give Them 10. Monica Terrence is the Chief Innovation Officer with Give Them 10 movement, creating cat-caring communities nationwide. She founded a trap, neuter, return organization in rural Illinois and pioneered one of the first large working cat programs. Monica helped Austin achieve a 98% live release rate for cats in 2012, then taught at Maddie's Fund Life Saving Academy, advancing shelter practices and public policy. She's a frequent speaker and advisor on community cat programming, shelter leadership, and building sustainable organizations. Welcome, Monica.
Thank you so much. Thanks, everybody. Can everybody hear me okay? If not, just don't hesitate to interrupt and wave your hand around so I can speak up. You can't? Do I need to speak even closer? Is that better?
Hello, everyone. How was lunch? Lunch was pretty amazing. Good, good, good. All right, well, we are back on track, no pun intended.
Is that supposed to be?
Oh, going.
Okay, how's that? Better. Okay, I'll try and speak up loudly. Again, just yell at me if you can't hear and I'll try and do better. I am impressed, this room full of people who care about feline leukemia cats. Are you kidding me? Yeah! Boy, have times changed, haven't they? How many of you guys are saving these cats today? Hell yeah, look at you all. 5 years ago, 3 years ago, this room would not have had all those hands up, so kudos to you guys. I'm so happy to hear that. I found myself in Austin with the largest feline leukemia program in the country back about 15 years ago. And I've been very fortunate to be able to work with these absolutely amazing cats and be a part of national research that's been happening with them for over a decade. So we're going to talk a lot about that research, what I've learned, and what we still don't know. Who in here is confused by feline leukemia? Testing, what their lifespan is? I'm confused too, so you're in good company. It's a confusing thing. Let's start with some easy stuff. These are just quick leukemia facts. There's a 2 to 4% prevalence in the United States, so not terrible. Who can tell me why the Northeast is so much better than the South? No, not cold. By the way, we're giving away t-shirts to correct answers. Because they spay and neuter, you win a t-shirt. Come see Scooter whenever you want. So yes, if you want to eradicate feline leukemia from this country, the best way to do it is through aggressive spay and neuter. That is why the Northeast is better than the South. They're years ahead of us on spay and neuter. A key takeaway, and we're going to talk more about this, don't worry, it is not possible to determine a cat's infection status based on any single point of time with any test. Throughout this presentation, I want you to think of feline leukemia like feline herpes virus. It ebbs and flows throughout the lifetime, right? If the cat is stressed, that viral load is going to go up when its immune system is functioning because we're low stress. that viral load goes down. Just like feline herpes, it is on a continuum and a wave throughout this cat's lives. The good news, as you guys know because you're all saving them, feline leukemia cats can be safely housed, stored, sheltered, adopted, just fine, no problems. We still don't know how long they live, so I'm sorry you're not getting an answer on that one today, but I'll give you some nudging. The good news is, also, lots of shelters are no longer testing at all. Is anybody in here not testing for feline leukemia? Good for you guys. You don't have to, so don't be embarrassed. Like we're gonna talk about, you don't have to in all certain circumstances. And there is absolutely no reason cats testing positive should ever be euthanized based solely on a blue dot. First, a tiny little recap about feline retroviruses. There are two. We're going to talk about feline leukemia today. We are not going to talk about FeLV because it is so insignificant we aren't going to even waste 2 minutes talking about it. Feline leukemia, however, is a disease of lovers. That's why these cats are so great, I'm convinced. Feline leukemia is spread through repeated, prolonged, intimate contact. FeLV, on the other hand, is spread through fighting. So leukemia is a disease of a virus of lovers. FeLV is a virus of fighters. This is spread close contact bodily fluids. So queen to kittens, housemates, also through fighting and mating. We're going to talk more about how it's spread, but it is not spread through casual, short contact. That means traveling in the car together, no. Playing footsies with each other through crates that are next to each other, no. I'm talking up close and personal for a long time swapping fluids is what feline leukemia takes. Or queen to kitten, or mating, obviously. The most common outcomes for a positive cat are they're either going to be progressive or regressive. Those are the two most common, but they're not the only stages of feline leukemia. Progressive is the cats that you're probably most familiar with. They're going to have high viral loads. They're going to have signs of the feline leukemia virus. They're going to have a shorter lifespan. We're going to talk about regressive cats, which you may not know a whole lot about. They're going to have a normal lifespan. They are not contagious, and they may test negative, but we're still going to call them a feline leukemia positive cat, and we'll talk more about why. Retrovirus guidelines have changed. This is the 2020 AAFP retrovirus guidelines that came out, and they radically changed the recommendations on how to handle FeLV and leukemia in shelters. I'm going to give you a link at the end so you can download this. Don't worry about trying to read that. The takeaway, and this is a big one, testing for feline leukemia and FeLV, the AAFP came out and said it's optional. You don't have to do it. Isn't that awesome? It is still recommended for cats that are co-housed and used as a diagnostic tool. So that means that we can't figure out what's kind of going on with this cat. We're going to do a little bit extra testing. But it's optional. Lots of shelters are not testing this anymore. The outcomes are classified as abortive, regressive, or progressive in the AAFP guidelines. We're going to talk more because we just threw another stage in there if you didn't notice. Because testing is confusing, expensive, and each cat's situation is unique, the new recommendation for shelters is a simple one-and-done approach. We're going to talk about that. But first, let's get into these stages. And I apologize if you can't read that all. I will make sure you all get the slides. So, abortive infection. This is essentially the cat was challenged, exposed to feline leukemia, and the immune system said, no thank you, I'm super strong, I'm doing great. No. And it rejects the feline leukemia virus. This cat has no proviral DNA circulating throughout the cat. It's not contagious. There is no feline leukemia. He basically encountered it and said no. His immune system was robust and fought it off. Negative cat. Then there's regressive. Regressive cat has controlled the spread of the infection. However, it is in their DNA, and so they're always going to have it. However, they may also test negative. We're going to consider this cat positive, even though he may test negative. I promise it will get less confusing as we go on. A cat with progressive infection, however, again, is the cats that you're most familiar with. They are going to have a shorter lifespan. They're going to have side effects associated with the virus. It's living in their bone marrow at this point when they are positive, progressive cat. So here's how the life cycle works, and it's really pretty simple, but it is along that continuum. The more robust a cat's immune system is, the lower their viral load will be. When the cat is more stressed, when the cat is sick, when they have a weaker immune system, the higher their viral load is going to be. And that becomes really important. But let's get back to who should test. So this is according to the AAFP, and I tend to agree with this. Cats who are co-housed at the shelter, the recommendation is to test. That makes sense, right? They're living together. So as a diagnostic, you may want to do certain cats or kittens. And you can go ahead and test everyone if it makes sense for your community. And when might it make sense for your community? That would be if you are an organization with resources, you feel good about spending that money, and you can use that test as a tool to give that cat better care. Or if your rescue partners require it. That's really pretty common, right? As a cat owner, though, everybody should test for this at their private practice vet. So why don't we want to test? What are you guys paying for a test right now in-house, a point-of-care test? 15 bucks? 30? Wow.
50 at the vet.
50? Well, don't you? Wow, okay. You can get them at IDEX for $9 if you get just a feline leukemia test, which you can do. You don't have to have FIV and leukemia. Anyway, it's expensive, right? And we are only catching a few cats a year at most shelters with pretty average intake. So at some point, we might ask ourselves, is that the best use of our funds to catch a handful of cats, especially if they're not co-housed, and the risk of transmission is so low? It might not be the best use of your money. It's okay to think about that. Again, you're going to spend that money, but that test is only going to be a snapshot of what is happening in the cat today. Not yesterday, and not necessarily tomorrow. So is it still a good use of money? We know that leukemia transmission is easily controlled through simple measures, routine cleaning. You do not need to keep these cats in a different ward. They can be in the same hospital unit. They can be right next to each other in the adoption center. You do not have to worry about feeling leukemia threats spread through fomites, through playing footsies. That is just not how it's done. We do believe that retroviruses are lifelong conditions that are better suited for the adopter to work with their private practice veterinarian, because this is a lifelong condition. And the adopter's house is their own unique thing. And this really isn't a shelter medicine issue. This is a lifelong cat issue that we encourage private practice veterinarians to get on board with. Okay, so how do we test? A lot of you guys are sending tests out, I hear. Some of you doing in-house? Okay, good. So the one and done is the approach. You test once, whatever it says, you're done. That's it. That is accurate most of the time. You can do a PCR confirmation. We doing some of that? I see some hands. We're doing PCR. We're also going up in money on each one, right? PCR confirmation you can do when you just want extra confirmation. I'm going to put it in quotes. Then there's the IDEX quantitative PCR. Anybody running those? Couple hands. Okay. You can use the quantitative PCR when a prognosis is desired. So, one and done, in-house, PCR, confirmation, quantitative when you want to know the prognosis of the cat, how much viral load is in the cat. So if you're testing in-house, there are really simple pitfalls that we can avoid. Select a good test. That is the most important part. You're going to use whole blood, not serum, not plasma, nothing else, whole blood. You're going to use it the way the test was intended. That means take it out of the refrigerator at the appropriate amount of time, use the correct amount of blood and conjugate, let it sit there and cook for the correct amount of time. Use it as it was intended, because your results are going to skew all over if you don't. Do not pool blood in 5 kittens in one test. Every kitten can be different, so don't combine multiple samples into one test. And moms and kittens can all be different, so we have to test them individually. Does anybody know why some kittens in litters are positive and some are negative? Who can guess?
Because they can have different parents.
They can have different parents, yes, close enough, you get a shirt. If you didn't know know, queens out in nature take turns litter sharing, and so queen may go from litter to litter to litter, spreading all of her goodness that's in her milk. Also, all the kittens may have different baby daddies, so mom and kittens can be totally different. We've got to test them all individually. So what is a good test? IDEX is the gold standard. I would implore you not to save money on this if you're doing these in-house. This is not the place to save $1 or $2. IDEX snap tests are by far the gold standard here. If you've got to save a couple dollars, I'll accept if you're running Zoetis witness tests. Okay, not bad. If you're running the BioNote antigen, I'm kind of going to give you the stink eye a little bit. And if you are running a Baxis test, I beg of you to throw them in the garbage immediately when you get home. They are inaccurate more often than they are accurate. Please throw them out. If you can imagine, I am not on the Baxis Christmas card list. IDEX. Okay, let's talk about that quantitative PCR test. This is the big expensive one that you can send out to get a prognosis. PCR means polymerase chain reaction. It's a big long word, and what this test does is look at the DNA of the cat, and it magnifies it, and magnifies it, and magnifies it until it can find the leukemia virus in the DNA, and that point is called your crossing point. The higher that crossing point is, that will determine your stage of infection. The higher that copy is, the number, it is associated with a decreased survival time. Now this test can miss the feline leukemia if the virus is extremely low and not in circulation. Even this test can also miss if the cat has a focalized infection. Has anybody ever heard of a focalized feline leukemia infection? Yeah, this gets real weird, guys. A cat, if I'm just testing the blood of a cat, I'm not going to get an infection that might be residing in, say, a spleen. So a focalized infection, this is a thing, I promise, I learned this. A cat can contain the feline leukemia virus in an organ or an organ system. That might mean the GI tract or a liver or whatever organ. But if I'm only testing the blood, and if this virus has not shed through the organ into the blood, you will never know it. You won't be able to test that cat. It will never come up positive unless you happen to biopsy that organ. So real weird these cats can get. These are usually $60 to $100 a piece, so you cannot do this for every cat, right? Even these test results may change. So think about when you're doing your budget if it makes sense to do this. I like these for private practice veterinarians because your typical pet guardian is going to come in and they're going to want answers and they're going to want to know the prognosis and well, what stage and how far along is it and what can we do. So this is again best done in private practice. And remember, the stage of infection does not change our management of the cat in the shelter. Positive is still positive. Regardless of how this test comes back, if the cat is positive, it gets the same treatment whether we're low positive or high positive. So here's what testing looks like. You can start testing at birth if you want, but we recommend around 6 weeks or at spay-neuter is great. Test at intake using whole blood and that IDEX ELISA test. That's your SNAP in-house test. If that cat comes up positive on that good test that you have used correctly, cat is positive, you're done. Move it to the adoption floor as a leukemia positive cat. If that test tests negative, that cat is negative, move it to the regular adoption floor. You are done, no more worrying about that. For nursing or pregnant queens, you're gonna test them with whole blood when they come in, and you're gonna test all the cats and kittens individually. You're gonna separate those babies from the positives and the negatives if you're able to. If you're able to and still keep both sets of kittens alive because we know that we want to keep them with mama. If negative, but there's been known exposure, test again in 30 days. That's about the period that feline leukemia takes to start circulating in the blood and be detectable. Have you ever had cats where you adopted a cat out and it was negative and you get the angry email from the adopter like 2 years later that the cat is now positive and somebody's died or, yeah. You'll get this sooner or later. And that's probably because the cat was positive when you got it and we tested it, but we didn't know because it happened 2 weeks ago before the cat came to us. And that can happen with any number of viruses or funguses, right? You've taken a ringworm cat that was exposed yesterday, you don't know it has ringworm until half your cattery is bald, right? So that's likely a good reason. It's got that 28-day incubation period. So if the known exposure retest, and I mean known exposure means like it came from a hoarder house, that's a common one, or it was living in a pet home with others. That does not, again, mean your transporter had them in the same car. That doesn't mean one got out of the condo in the shelter and mingled with the others all night long. I mean it was living and sharing spit and swapping food with somebody for a long time. That's significant exposure. Who's had confusing test results? Yeah, I thought all the hands would go up now. Yes. Have we gotten into trying to figure out who's regressive and who's positive at your organizations? Anybody dipping into that yet? A couple of you? If your cat is regressive, we're still going to call him or her a positive leukemia cat. Even though this cat may test negative, we're still going to consider it a positive cat. This cat's going to go on to live with other positive cats in your positive feline leukemia adoption ward. That is because at some point in this cat's life, because the virus is residing in its DNA, it could become progressively infected. That is when they get contagious. So right now, regressive means there's so low viral loads in this cat that is undetectable on most tests, or any test. But we know the cat has feline leukemia living in its DNA. And at any point in this cat's life, again, it could start shedding. So I'm going to adopt this cat out as a positive cat. The good news is, even if he turns out to be abortive, totally gets rid of the infection, he's likely got enough of an immune system that he's going to keep fighting that feline leukemia off. And by living with positive cats, he's not going to get any more feline leukemia. So adopt him out as a positive cat. Who's doing confirmation testing? You're hesitant to raise your hands for good reason. There is no such thing. I'm sorry to tell you there is no such thing as confirmation testing. You may as well take your money out in the parking lot and light it on fire. I'm very sorry. So repeated tests often have discordant results anyway. And here's a... Oh, did we turn off? I'm good? Okay. Up to 25% of cats are going to be discordant. Discordant means their test results are all over the place from month to month and test to test. They're the ones who are keeping you up at night. They're the ones I'm getting emails about, like, what is going on with this cat? A quarter of them. Any test is a snapshot, again, of what is happening in that cat today, not tomorrow. So again, your confirmation testing is only telling you what's going on this afternoon. I hope nobody's still running IFA tests. They have no place in feline leukemia testing anymore. Get rid of them. No more sending those out. The only way to determine the stage of feline leukemia infection is that quantitative PCR testing. Again, we're going to use that in private practice for people who can afford it, or reserve it for those unique cases that are really keeping you in the vet up at night and you're dying to know what's going on. Simplified testing, real easy. If it tests positive on that IDEX SNAP test at intake, it moves to the leukemia adoption center. If it's negative, it goes to the regular adoption center. Okay, quiz time. Let's give away some shirts. These are some of the original Foundation study cats that we used in Austin 10, 12 years ago. We were trying to figure out what is the best test for cats, and using blood, whole blood, plasma, serum, all the things. We enrolled about 100 cats, and they all had control cats as well. So these are some of the cats from that original study. So I'm going to tell you what they tested at intake on an IDEX SNAP test, and now I'm going to show you how they tested through 6 months on all the tests that exist in the world. So this is Sierra Nevada, a 3-month-old male. On his IDEX SNAP whole blood, you can see right next to his photo there, he tested negative. Would you call this cat uninfected, regressively infected, progressively infected, or, I don't know, tested more? Unaffected. Uninfected. Absolutely. This is an easy one, so I'm not going to give you a shirt for that. So you can see here that this is Sierra Nevada. Nevada's month 0 test. That's when we first intake the cat. His month 0 test across all those different types of tests. Lovely. Sierra Nevada is just ducky, right? No, nothing there. And he stayed negative, of course, through all of his 6 months. Awesome. Here we have Basil, a 2-year-old spayed female, and she's rocking her beautiful little ear tip there. You can see that Basil tested positive on her snap test at intake. What do you think she is? Positive. We had somebody over here, so was first, so you get a t-shirt. So Basil tested positive across the board on the entire gamut of available tests, right? And you see that where it says quantitative PCR, it says high, that means I've got a high viral load, that means I have a progressive infection, which means I am most likely to have a shorter lifespan and suffer the effects of feline leukemia than if it were to say low. And in fact, here is how Basil progressed through 6 more months of testing. We stayed nice and positive the entire time, no changes. Again, this is not a cat that keeps us up at night. We know that Basil has feline leukemia. Easy cheesy. Now you know what's happening here, right? You know what's coming. Here's Crayola. And again, this is a real cat. Crayola was a 3-month-old male castrated who tested negative on Crayola's intake exam. What do you think? You would think uninfected. You would be wrong. Basil came up low on that PCR test, so I've got a low load of the virus in my blood. But it was positive. We did find it. So we're going to call that regressive. You see what that means? We can't find it using anything other than incredibly advanced tests. He's not infectious at this point. He's regressive because his whole blood is negative, but that PCR says I've got a little bit hanging out in my DNA. That's a regressive cat. What do you think happened to Crayola moving on? Is he gonna turn abortive and get rid of it? Is he gonna get positive? You don't know. Here's what Crayola did. Crayola was a cat where I would call Dr. Levy, and I'm sure some of you in here know Dr. Levy, who kind of pioneered our feline leukemia knowledge. And Crayola was a cat where I would call her and I'm like, what is this? And she'd be like, I don't know. And when Dr. Levy tells you she doesn't know, you get real frightened. Crayola was across the board, up and down, all over the place, from test to test, from month to month. He is incredibly discordant. You will never know what Crayola has going on. So here's an extra one. What do you think was happening to Crayola during these times of his life? At month 1? Stress. This table. Who gets a t-shirt? Somebody over here. Great. At month 1, he had just come into the shelter. That sucks. His immune system went, oh, I hate this. I'm very stressed. Give me all the feline leukemia. I cannot keep it at bay. What do you think happened at 5 and 6 months? He got adopted and went to a pet home, and his stress level went, oh yeah, this is great. Heck with you, feline leukemia virus. You can't even find me, even on a quantitative PCR test. I've completely aborted the infection, Crayola said. Until month 24 and 36, way down, years down the road, when he went, just kidding, Mom. I'm still positive. He is incredibly discordant. 25% of cats are going to have wacky, discordant results like this when they test positive. That's real goofy, right? But this is the reality of feline leukemia virus, and this is again why I said think of it like feline herpes virus, where it's ebbing and flowing throughout the life of the cat. It's always going to change. You see now also why that test that you take today may look totally different tomorrow, and it's only this point in time, only showing you today. Crayola is a great example of that. Okay, so what's not changed with feline leukemia in the last few years? It remains completely safe to house care for and adopt these guys out. Still safe that you can easily control feline leukemia, common sense precautions. The feline leukemia vaccine, the good news is it works. The bad news is it's not going to work if you already have feline leukemia. Does not help in that case. It remains the case that cats coming in for TNR or return to home, do not test them. absolutely not spend your money on that. They should not be tested. If you do test one for some goofy reason and the cat is positive for feline leukemia, put it back. It's fine. You've just taken away his primary modes of spreading feline leukemia. He's already been exposed to those colony cats his whole life anyway. It's like closing the doors after the barn doors after the cows are out. You can go ahead and put that positive cat back even if you find out he's positive. And that IDEX snap test remains the absolute best test that money can buy today. Okay, so you've got a positive cat on your hands. Get them out of the shelter. That is your number one priority. Get them out, foster home or adopt them. They should be individually housed at the shelter or with other feline leukemia cats. They can mingle with progressives, regressive, whatever, positive with positives, they can mingle together. They don't need an isolation ward. They don't need a special adoption center. They can be right next to the negative cats, no problem, and not spread feline leukemia. I promise that you can adopt these cats out. You don't have to send them somewhere. I've got shelters in all 50 states who are adopting these cats out all day long. You can do it, and we're going to help you get there. Okay, so outcome options for these guys. Here's how to get them adopted, some of the reasons, or some tips. These cats must be visible and accessible, so please don't hide them in the back. Adopters have to be able to locate them. In Austin, we put on our website here, cats, you can filter by need, and so we literally had a special needs search on our website amongst cats where if you wanted a feline leukemia cat, you could select that as your special need to see all of our feline leukemia cats. I would have people in Austin driving states away to adopt a feline leukemia cat from us because their local shelter sent them all to Austin and said they couldn't adopt them out. You've got adopters in your state that are looking for them, I promise you. I like to do zero adoption fee on these cats because to me a special need means a special fee. That's up to you. I had a sign in my adoption centers all the time that said, think FeLV first. And you'll have to excuse me, I call feline leukemia FeLV because it's quicker. Think FeLV first. That means if I have an adopter come in who's like, yeah, I don't have any other cats at home, I'm a little bit flighty maybe, I don't know where I'm going to be in 20 years, maybe I'm in the military or moving, or maybe I'm just a young person who doesn't know where I'm going to be in 20 years. Maybe you're just a bleeding heart and you're like, oh, look at these poor babies, which is the one here that needs me the most? Think FeLV first. You introduce them to your leukemia positive cats. And walk the walk. This one is, I think, the most important. If I'm a normal person, I'm a member of the public, and I walk into your shelter and you've got feline leukemia cats or FIV cats sequestered in their own room, and you've got signs up about them, and you're putting on gloves to go handle them, what are you telling me? It's not safe. You get a t-shirt.
I already got one.
Give it to someone else. You are telling them these cats are not safe to be around other cats. You're the expert. I don't know what this is, but you're putting on gloves to touch them. I don't want that in my house. It's clearly dangerous. You know better. Walk the walk. Let people go in and touch them. They can touch them and then they can touch the next cat. I promise you. They're not going to spread feline leukemia. Let people touch and interact with these cats. Do not put scary signs up about them. You don't have to keep them sequestered, and they certainly don't need to be locked up. So in Austin, this is another study we ran. We were adopting literally hundreds and hundreds of cats per year. And so we had a couple things go on. We came up with a term that I called FeLV fever. And this is when an adopter would adopt a feline leukemia positive cat. The cat would inevitably pass away, and they would come back and get another cat, another positive cat, and then another positive cat. And then we see them a few years later, and she wants another positive cat. They would come back over and over and adopt feline leukemia cats. And so Maddie's friend and I did another study to look at adopter satisfaction for our feline leukemia positive cats. And we did this across about 1,000 adopters with controls. These are just a few of the questions, my favorites that are up here. So the top left says, overall, how would you rate your experience living with this cat? 74%, big green there, said overwhelmingly positive. On the bottom, overall, the impact of your adoption on your life has been 84% very positive. the right is my absolute favorite. How likely would you be to adopt a feline leukemia cat again if you were in the same situation, but knowing what you know now about feline leukemia? Would you do it again? 73% said, yeah, sign me up. That's who's going to adopt these cats, everybody. We also ran the control cats. Remember, this is also super interesting. Versus our control cats, our negative cats, our positive cat adopters had higher rates of attachment to their cat than our negative adopters. They had a higher satisfaction with the adoption process, and they were happier with their cat on a daily basis than our negative adopters were. They also rated the organization higher. They were more likely to become a foster donor or volunteer with us than our negative cat adopters. That's pretty powerful, especially if you're trying to convince your boss that you should do this, right? Okay, I know this is the burning question, how long do they live? Part of the reason we started this big study in Austin a decade ago was because I had this feline leukemia adoption center, and I'm expecting these cats to be passing away and be looking sick, and none of that was happening. And at one point I went, these cats aren't dying. They're supposed to die, but they're not dying. What's happening? And I'm an enormous data nerd, and so I started keeping just spreadsheets of every detail I could find about these cats, trying to figure out, is there any correlation between why this cat is dying and this cat is staying alive for years? And I mean, I was tracking coat color and where it came from, just mountains, terabytes of data. And it was then that Dr. Levy, I told her about this, and she decided we need to study on this. But here's what we know about lifespan, because they're not all dying, right? On the top is our uninfective aborted cats, that top line. So you can see we're fine. We're not passing away any earlier. That next line, that red line, those are regressive cats. They've got feline leukemia in their DNA. Guess what? They're doing fine. So far, and we're still tracking these cats. We're in about a decade in. They're doing fine. That bottom line is you're progressively infected. That's with the high viral load. That's what we expect, right? That is the shortened lifespan. The good news is it's not 2 years. I know you all hear 2 years all the time, their average lifespan. You can throw that out. We don't know. But a whole lot of them are still alive 5, 6, 7, 8, 9, 10 years in, who are progressively infected. Some of your adopters may lose that cat the next day that they take it home. Some of them may have it for a decade. We don't know. Good news is a lot of these cats have undergone FIP treatment. They come out the other side just as well. In fact, we've got another study going on about this right now, but you can't put these cats through FIP treatment. There is still no recommended treatment or cure or snake oil or voodoo for these cats. I know that you're trying to be sold these things. It does not exist. No interferon, no tea tree, don't rub coconut oil on the cat, none of it. There's nothing yet that works. I'm sorry. It's anecdotal, but we all know this. We're pretty confident calling it a fact at this point. Reducing stress is the single most important thing you can do to promote the health of your feline leukemia positive cats. Our studies are all showing that their survival rates go way up when they are in a private home, normal home, without a ton of other cats there. I still don't recommend that you adopt out a feline leukemia positive cat into a negative home. I'm not going to criticize you if you do. Lots of shelters and rescues do this. It's your decision. I'm not going to argue with you about it at all. I'm not even going to judge you on it. I'm not going to do it. And the reason I'm not going to do it is because I have an ethical problem with it. It might just be me of saying, I know that this cat has a fatal virus, a lifelong virus. I can't in good conscience infect the other cats in the house, even if that risk is low, even if you vaccinated them. I'm not comfortable with it. But you can. If you're good with that, lots of shelters and rescues are. You're not going to get pushback on it. Okay, I suspect some of you in this room have this problem. Where you're like, yes, I love these cats, or even FIV cats, but our boss says, or somebody says, or the board says, or the county commissioner says. The bus is leaving. It's left on feline leukemia cats. And if you are not on it, you're being left behind. The rest of us are adopting these cats out. You've seen all the hands in the room. No executive director wants to be known like that. Feline leukemia adoption programs are now the norm. That's where we are in this country. We've gotten there so much quicker than we did with FIV cats that leukemia adoption programs are now the norm. If you aren't there yet, we are snickering about you at all these conferences. That's what you tell your boss. You're being left behind or outdated. If you ask to transfer your positive cat to a different organization, be prepared to answer the question, why can't you do it? And take that question back to your boss and say, what do you want me to tell this organization that's asking why we can't do it? I'm not real comfortable telling them we just don't believe in science. What would you like me to tell them? This is great news. Is anybody from PetSmart here? We have PetSmart? Well, it's too bad that we don't, because in 2025, I worked with PetSmart and they rolled out a pilot program last year to adopt feline leukemia cats in stores. And in January of 2025, it went national at all stores across the country. You can now bring in your feline leukemia positive cats. Absolutely. Enormous kudos to PetSmart for taking the lead and following science. If anyone has concerns about this, it's a giant billion-dollar corporation, right? They're okay with the risk. Why isn't your boss? These are great things to maybe don't say that to your boss, but these are great things to approach your boss with. Okay, so final thoughts and tips, and then I know we've got questions. For the love of God, reduce the stress. I cannot emphasize it enough. Reduce stress. Any means possible. Foster homes, adoptive homes. Here's another tip, and this one's a little, we haven't come out and talked about this one yet, so it's a little anecdotal. If you can, delay spay-neuter until they're 6 months of age and in a real home. When we do this, we see the rate of FIP go down 500%. Until that immune system is robust enough to be mature and doing its thing and working, the feline leukemia cats really can't handle that attack on their body of spaying and neutering. They have a much, 500% times higher rate of contracting FIP, coming down with FIP, dying of FIP immediately after spay-neuter surgery than if you wait until they're 6 months old and in a home. So for us, that means the adoption doesn't finalize when you're technically a foster or whatever, come back when you're 6 months old and you're in a home, and then we'll neuter you. And those cats do great. So that's a tip. Be honest with your doctors. We don't know how long they're going to live. That's an answer. That's the truth. It's okay to say that. It's okay to say, you know, this cat may pass away soon. It may pass away 10 years from now. I can't tell you. What I can tell you is that we believe that this cat still deserves a quality of life for whatever time it has left, and we're here to advocate for it and support you every step of the way. That's what you can tell doctors. And this photo I talk about on every one of my feline leukemia presentations, and I'll try to get through it without tearing up. You would think after all these years I could do it, but this photo is of Helena and Jackie. Helena is the cat. She was one of my positive cats in Austin. And Helena, she wasn't the most personable cat, we'll say. Helena had been with us for about 2 years at this point. She was incontinent, that's why she's wearing a diaper in number 2. So she leaked urine and needed to be expressed several times throughout the day. Helena also had a full mouth extraction for stomatitis, and so it would flare up every now and again, so she needed to be syringe-fed baby food a few times a day, often. And because she didn't have enough against her, Helena also had ringworm at the time of her adoption. And one day, Jackie came into our adoption center. Jackie is the mom there. And Jackie said, "I'm here to adopt a cat, but I've never had a cat before. In fact, I've never even had so much as a goldfish." And my adopters went, "You seem like a bleeding heart. I'm thinking FeLV first." And they walked her into the Feline leukemia adoption room. And Jackie fell in love with Helena. Helena became the absolute joy of Jackie's life for the next several years. Jackie went on to become a volunteer and a donor for us. She still volunteers in the Feline Leukemia Adoption Center. She became a powerful advocate for these cats. She cannot shut up talking about feline leukemia cats to all of her friends and family and everyone she knows, because Helena became the light of her life, and she realized that in many shelters at that time, Helena would have been euthanized for that blue dot on a test, and Jackie wasn't having it. She knew that other cats like Helena were out there. The photo on the end, and I'm going to try to do it, was Helena's euthanasia appointment. Jackie makes me put this photo up. Jackie makes me put this photo up so that all of you recognize that these cats are loved and wanted and they deserve a chance at life. And there are people out there who love them. That's what I've got for you. I did it. No tears. If you want to put your camera up, that'll take you to the 2020 AAFP retrovirus guidelines that we're talking about. And I think we've got time for questions. Yes? Okay, awesome. Yeah.
Any questions?
Come get your shirt if you want a shirt too.
Everybody's taking a picture of your screen.
And I've got business cards up here if you want to email me and chat more later.
So I've always been under the impression they need to be 6 months old before you test them. Clearly not, because you're testing at 3
Yeah.
months. But is there a better chance of it being correct diagnosis if you wait till they're a certain age?
Yeah. Can you hear me if I just talk loud? Okay. So the question, is it accurate at below 6 months of age? Is it more accurate if we wait till they're at least 6 months of age? You can test for feline leukemia at birth. It's looking at antigens, it's not looking at antibodies like FeLV where you're going to get that wonky test result. So you can test at birth. However, because cat, what we know about neonates, and we can't explain this yet, is that they are weird. Neonatal kittens who are infected with feline leukemia virus right now have a 56% higher chance of retesting negative, abortive, down the road than an adult cat. We don't know why. This is, again, I called Dr. Levin, she's like, I don't know. We need to run some tests. We don't know. So there's something weird with neonates. What I would do if I had the luxury was test them when they come in for spay-neuter at 6 to 8 weeks. One and done. If you have to test them because I understand they're going to a foster home, blah, blah, blah. If you've got the money, you can test. If one is positive, you can test again. If we're negative at birth, we never need to test again. If we're a neonate that tests positive, I would probably, knowing me, I would test it again at 8 weeks. Well, at neuter. Does that make sense? As much as it's gonna? Okay.
I have 2 questions. As far as FIV goes, we had a positive mom, and her kittens, we tested the kittens like at 3 months, and they all tested negative. And they said, but you have to test again at 6 months because until they've no more milk, because they were still sucking off of it. Anyway, so at 6 months, they all tested negative. So is that kind of the same thing, like because they're no longer taking the milk in, or with that? So
they're actually getting FIV antibodies from mama that are passed down, and they take that long to work out of cat's system. So it's not even by the milk transmission. It takes that long to get it out. I would never, ever, I don't test for FIV at all anymore. I would never test a cat a second time and spend the money. I know a lot of you have to test for FIV, or you've got some thoughts about it. My favorite slogan in the world is FIV is stupid. It has no statistical difference of the lifespan of a positive cat by a negative cat. We've got some anecdotal things, but there's never been a single study that has linked one side effect known to FIV. In all my years of being in cat welfare, I've never seen a cat die of FIV, nor have any of my veterinarians that I've worked with. It's stupid. I really recommend you quit testing for it. Most shelters, most maybe in the Midwest, but a lot have quit testing for it. You can buy just the feline leukemia test for less money. If you are testing and the cat is positive, please, for the love of God, absolutely no adoption restrictions. They can go anywhere. It's fine. Is there another one?
Yeah, a second question. The FIP treatment.
Yeah.
I'm hearing people talk about what a great result they're getting from those. Do you know what those cost, and what does it cost to put a cat through that?
Yeah, lots of folks in the room can answer you. The good news is that we now have one pharmacy who is legitimate making it for us, compounding it, so you don't have to get it through through, you know, through the Facebook groups that exist to help you get it. It's come down in price since the early days, thank God, but what is it now?
I was just quoted, depending on the brand, $600 to $2,500.
Okay, so that's not, I mean,
It's not the $8,000.
a few years ago, we were spending $8,000 per cat and getting it from God knows where. Yeah, so it is available now via legit compounding pharmacy, only one. Another question?
Just your opinion on a test results question. We had a cat, he used to have a dental, and he's got chronic upper respiratory. In-house test, which was not an IDEX stab test, showed slight positive. PCR came back negative. Do you consider that negative?
I sure would.
Excellent, thank you.
Yeah, right behind.
When prepping a room that housed a positive cat to then house a negative cat, are there any specific cleaning protocols you recommend besides?
Great question. So feline leukemia cat, positive cats, we're living in a room, I want to put negative in there. Is there any specific cleaning protocol? Nope. Just clean the room. Feline leukemia is killed within, it's inactivated within minutes just being in the air. It is killed by the most weak of chemicals in the world. You can spray Windex on it and it will kill it. No, absolutely no. You don't need special tools. You don't need special cleaner. You don't need special bowls, litter boxes, nothing. Clean it like regular. That's not how feline leukemia is spread. And I think we're out of time, right? But I will happily answer feline leukemia questions the rest of the time. I love it. I can never talk about it.
We'll have a 10-minute break. The sessions will start at 1:45, and you'll be hanging out up here. If you have any questions, you can come up.
And if you want a
during the
shirt,
break.
come get your shirt.
If you want a shirt, come get a shirt.
I appreciate it. We're going to There's different sizes, so.
Come across the picture. This is a 2X. By the way, excellent.
Thank you.
Who wants an extra one?
Made my friend suck a cat who was thrown over a bridge and blind. We actually saved his eyes, so
Yeah, but you said you were positive?
You're
but
leaving the entire cat
I
game.
never had heard of this, and the vets haven't asked if I wanted to test for it. So
Now you know.
And I was like, okay, but what does it matter? What is the...
Yeah.
You're throwing terms out there, FIP, but I don't know what any of that means, so
Well,
this was good for
you'll
me.
get there, yeah.
The ladies at my table were very nice to hold me and all that. So, but I
Thank you
appreciate
for
all the
attending.
information.
I'm so glad. It's helpful.
It was very
Good, thank you.
Thanks, Kitty.
Yeah. Yeah. Yep. Yeah.
There's other cats in there. In fact, I just heard about a mom out there. I'm going to meet her and get what is the possibilities? Because, you know, Indian Tomcat, he probably had something to do with this. He was probably... So should I, since she has babies, test her this week?
No testing. Cats.
What if the baby's in that we can adopt it?
Babies you'll test. Think about these tests, you're all paying $25-$30. You can do her a cat for that.
Yeah. See, that's what I understand, because I haven't been through Territory's very backwards on FIV.
Yeah, I know. Yeah, I know. Midwest is for some reason. It drives me crazy.
And, you know,
I'm a Midwest girl.
I've gotten to the point now that everybody that's adopted is